what's your general guidelines for physical
Okay.
activity?
Number one rule of thumb, get exercising or get to your normal daily routine as soon as you can. Okay?
So don't just stay at home.
Don't just stay at home. Don't just
Watch TV,
watch
Netflix.
TV, Netflix. It's because I have cancer and my body is weak. That I should not be doing strenuous activity. Wrong. Okay, you have to start exercising as soon as you can, as soon as you're able to.
Hi everyone, welcome again to another episode of Simply Healed. We're so happy that you are here with us again today. And Dr. Johnson, welcome again.
Hi, Sean. Hello, everyone. Glad to be here again.
Today's topic is very useful and very hopeful because today we're going to talk about what do you do when you are in remission, a glimpse of what remission looks like. And that's something exciting. I pray that every one of our viewers, that we are all believing for that day where you will be declared in remission. Doc, remission is a medical term.
Yes,
what does
yes,
it
yes.
actually mean?
Okay, so when we talk about remission, it is the period or the time when there are already no detectable cancers inside your body. By no detectable, what do I mean by no detectable cancer? So number one, there are no signs of cancer in imaging, in your imaging studies, and the tumor markers are normal. Okay,
So in other words, a key factor of this knowing that you're in remission is that you have to go for diagnostics.
yes.
So imaging is clear. So your CT scan, MRI scans
Correct.
are clear. No more signs of tumor.
Correct.
And your chemistry is all your markers are
Normal.
normal.
Yes, correct. So that is what remission is.
Doc, before you go on, I just want to ask, when we are considered in remission, and even for healthy people, does that mean that we are free from cancer cells?
Technically not, no, because there's still circulating cancer cells inside your body. It's just that your immune system can now fight them off. So there are no signs of recurrence. And also we have to consider the ability of the imaging studies and the tests to detect the cancer. Now, yes, there will be circulating cancer cells inside your body, but they are not detectable by our present technology. Okay?
And Doc, and that's one of the great challenges in cancer, in trying to catch cancer early, because it's very, very difficult to detect cancer in its early stages, simply because your markers could be normal,
Yes.
or not high enough to make you think that you have cancer. And even if you suspect that you have cancer, it's too small to find any tumor, but yet it has already begun. All right, Doc, so when we are in remission, what are the key goals that our viewers can look forward to when the doctor tells them, hey, your scan looks good, your blood works came back, everything looks great, you can ring the bell, ding, 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 victory,
Yes,
right?
yes. So
what's the goal right now?
yeah. So I know this is the day that we really pray for, no? The day that your doctor tells you that you are already cancer-free, you are already in remission. Okay? So the primary goal now, because at this point in time, it's very important that you prevent the recurrence of cancer.
It's very, very important that during remission, your focus is now on preventing recurrence. So you have to fight just as hard,
Yes.
but just differently, going for chemo
Yes,
sessions
yes.
or anything.
Yeah.
But you got to be as mindful and focused as you were when you're fighting cancer. Because even for something as common and as treatable as breast cancer, 1 in 3 breast cancer will come back. And definitely the second round will be a lot tougher to treat than the first.
Correct. Now, the second goal for patients who are in remission is to prolong the disease-free survival. This is also the period of time where you are basically in remission.
What's disease-free?
So, yeah, disease-free means that there are no detectable cancer in your body. So, it's basically remission.
Okay, basically
so this
stay in
yes.
remission.
So, we have to the goal is to prolong the period of time wherein you are in remission. Okay, so that's the number one goal. So it's basically prevention of recurrence. Okay, so
What are the key factors? What are the main pillars that a cancer patient who's now in remission, cancer-free, should focus on?
there are a number of factors that you need to take note of. So number one is nutrition or the diet that you eat. Number two is physical activity. Number three are supplements. You will need nutritional supplements for this. And lastly, what are the signs that you need to look for to know that you already have recurrence and you need to go to go back to your onco for a follow-up. Okay?
I think the last one is a very good tip for all the cancer patients in remission out there. Knowing what are the signs.
Yes.
And today, in today's world, especially like if you want to have a consult with Dr. Johnson, it's a teleconsult. So knowing the signs is a great thing because it's very convenient from your own home. You will know whether you need a further appointment or not.
Yes, because these signs, which we will discuss later, sometimes can be confused with mild symptoms which are not related to your cancer at all. So it might cause unwanted.
So if you every
worries.
time you have a little bit of a cough, if you have to go to the clinic and queue up, that's very difficult.
You'll be paranoid. So I mean.
So that's why that teleconsult is really very easy. You don't have to queue up. You just have to have a scheduled appointment. 5 minutes. If there's nothing wrong, 5 minutes you're done.
Exactly. You don't have to waste your time falling in line in front of the doctor's clinic anymore.
But it's so important. We'll talk about that again.
Yeah.
So
Okay.
Doc, let's go straight to diet. What is the key kind of diet cancer patient in remission should adhere to so that they stay cancer free?
Now, I've told my patients again and again and again. Okay, among all of the factors that you need to do, the food that you eat is the most important one. Because even if you do all of the tests, all of the treatment protocols in the world, the most expensive one, if you still eat junk, then you'll still be sick. Okay, your cancer will recur, and if cancer does not kill you, it will be heart disease, and it will be the other diseases. Okay, so this is not just to help your cancer, help prevent cancer. It's to really make your whole body healthier. Okay, so what is the approach? Right, so the diet we eat to prevent cancer is the same diet that we eat to prevent recurrence. Okay, so it is a whole food plant-based diet. This is the only diet that has been proven to show reversal of cancer. Okay? So what does a whole food plant-based diet mean? So whole foods means it's unprocessed and unrefined. Nothing edible has been removed from the food. Okay? And a whole food plant-based diet consists of fruits, vegetables, whole grains, and legumes. Okay? So those 4 food groups. You have to focus on those 4 food groups.
What are legumes? Just in case, because that's a vegetable word that not everybody is familiar with.
Yes, legumes are anything that grows out of a pod. So that would be your beans, nuts, and seeds.
So we are in Philippines. We're talking about
Mongo,
long beans.
Long beans.
Everybody
sitaw.
likes long beans.
Yes.
Sitaw. Everybody likes sitaw.
Yes.
And I like actually sweet peas because those are very nice.
Yes.
So,
aside from those, your garbanzos, your tofu, your soybeans, those are legumes.
Yeah, that's
as well.
true.
Okay, so those are the foods that you need to eat. And how about the foods that you need to avoid? So in general, that would be no animal protein. So because animal protein can increase a substance called IGF-1 in our body. So IGF-1 means insulin-like growth factor 1. So that growth factor promotes tumor growth. And that growth factor can eradicate all the effects of a plant-based diet very easily. Okay, with just a small, even with just a small amount. So it's very important that we keep it at a very low level. And again, remind you, animal protein, consumption of animal protein will increase IGF-1. Okay?
And so that's the key scientific reason why you want to avoid animal protein.
Yes.
Now, does animal protein also include fish? Because a lot of time people say animal protein is no chicken, no beef, no pork, right? And then fish is like the exception.
The exception. Fishes are animals, right? So
and you know
that includes fish. Yes.
And you know today there's lots of controversy in terms of harvested fish, farmed fish, a lot of antibiotics. So that's the problem of farmed fish. That means cultured fish. Then if you catch fish in the wild, we have the problem of
heavy metals,
mercury, chemical, what's that called? Toxic substances found in the fish, even in deep sea fish.
Exactly.
Yeah. So literally now it's really difficult to get clean fish.
Other foods that you have to be mindful of are saturated fats. So oils, no. So no oils. Why? Because oils, especially saturated fats, can promote metastasis. Okay, so you do not want that.
Wow.
Okay, so number 3 is refined carbohydrates. refined carbohydrates is also known as sugar, okay, or
Alright.
food items which are already devoid of fiber. Okay, so that would be your white rice, your breads, your candies, your French fries. Okay, so these things. So why should you be avoiding refined carbohydrates? Because it already has very low amount of fiber. Now, if you consume that, your intestine will absorb all of the sugar in that food all at once. So that will spike up your blood sugar, that will spike up your insulin. A very high insulin level can also mimic the effect of IGF-1 because IGF-1 is again what? Insulin-like growth factor 1.
It promotes tumor growth.
Promotes tumor growth. So insulin also has a similar effect. So you have to be very careful about refined carbohydrates.
And
Alright?
refined carbohydrates is basically your alcohol too, because alcohol
Exactly.
is basically carbohydrates.
Exactly.
All right. So don't
Okay.
avoid drinking.
Avoid drinking any alcoholic beverages.
So eat a healthy diet, but our daily life is hard to really eat healthy because the foods that we have are quite limited in terms of nutrition. So vitamins and supplements, is
Yep.
that going to be part of your life once you're in remission?
Yes, very much so. Because there are certain foods that you have to keep eating every day to prevent or to lower the chance of your cancer coming back. Okay? So how should you be choosing your supplements? So I would choose this way. Number one question that you have to ask, is this a whole food supplement? So meaning, is this supplement an extract or not? Okay? Because sometimes when we isolate a substance, okay, from the whole food, it becomes harmful.
Yes.
Okay? More often than not, but I'm not saying it happens to all cases. Okay? More often than not, it is so. So singular vitamin, minerals, or multivitamin supplements will not prevent recurrence.
So again, as Dr. Johnson said, when choosing supplements, the first rule of thumb is if you can, get a whole food supplement.
Yes.
What are some examples of whole
What
foods?
are some examples of whole food supplements? So these would be like your turmeric powder, garlic powder, or garlic capsules, turmeric capsules as well, your microalgae like Simply Nature pea pars. Okay, so that is also a whole food supplement. Your malunggay, your mangosteen. Okay, so those are whole food supplements. Okay, so but however, no.
Is there a
how
particular
they-
vitamin? Because if you're plant-based diet, there is one particular vitamin that's actually important.
Yes, it's vitamin B12.
Okay.
Now, vitamin B12, why is it so important? Now, vitamin B12 is only made by bacteria. So, we cannot actually source this naturally from plants. And we only get vitamin B12 naturally through animal food products or animal protein. Okay? How is it so? It's because these animals, the cattle, the poultry, the fishes, the seafood, they graze. When they graze, when they eat the food around in their environment, they also eat the bacteria. So the bacteria that produces the vitamin B12, they also are able to eat. So the vitamin B12 made by the bacteria that they just ate, they store it in their body. And we humans eat the meat. Okay?
And we transfer the bacteria.
We transfer the vitamin B12 of the meat of the animals to our body. So
Doc, the last pillar, physical activity. What's your general guidelines for physical
okay,
activity?
number one rule of thumb: get exercising or get to your normal daily routine as soon as you can. Okay.
So don't just stay at home.
Don't just stay at home. Don't just
Watch TV,
watch
Netflix.
TV, Netflix. It's because I have cancer and my body is weak that I should not be doing strenuous activity. Wrong. Okay, you have to start exercising as soon as you can, as soon as you're able to.
How many hours a week?
How many hours a week? General rule of thumb would be 150 minutes per week of moderate intensity physical activity. Okay, so that is the initial goal that you need to hit.
150 will be 2.5 hours.
Yes, 2.5 hours. So you
Per
can
week.
just imagine.
Half an
That's
hour per
week.
day.
Yeah,
About half an hour per day.
half an hour per day. So it's manageable. And if you are someone who's really busy, you're an office worker, you're a boss of your own company, right? So you can just do 10-minute sessions in the whole day. So that is the initial goal, okay? But you have to do more.
Oh wow. Okay.
Yes,
So it's
you
not
have
enough.
to do more. It's not enough. That is only the initial goal that I usually advise patients. Now, how much physical activity do you need to do to have a significant effect on the survival rate? Okay, it's more than 9 Met hour per week. Okay, so more than 9 met hour per week of physical activity increases cancer survival rates as much as 49%. So what does more than 9 met hour per week look like?
That's very technical.
So in terms of walking, that would be equal to almost like at least 3 hours of walking per week at a pace of 2 to 3 miles per hour.
So that's pretty quick.
Yeah, that's pretty quick. It's a brisk walking.
It's a brisk walking. It's not a slow, normal walk. It's what you do when you're walking to catch the bus, knowing that you're about to be late.
Yes. Okay, and also more than 360 minutes per week of exercise reduces the risk of dying from cancer by 70%.
70%.
Okay,
I think this is one of the most significant things you can do. But you know, Doc, it's really not easy. It is about 1 hour of exercise a day. That's a real commitment. But if you can do it, I think the other benefits is that you look good.
Yes. So what I usually tell patients is that the exercises or the physical activity that you do should be something that you really enjoy or something that you love doing.
Yeah. Or you know, you just keep telling yourself you're gonna be sexy. You're gonna be sexy. All right. That's what I do when I run on the treadmill.
Now, here's also another another problem. Now, a majority of cancer patients now, when they are already on remission, they are so thin already. So how do you then bulk up your muscles? Because some of them are already underweight, and we all know that it can also be dangerous, right? So how do you bulk up your muscles? Number one, you have to eat a lot of protein, plant protein. Plant protein, all right? Number two, you have to do resistance exercises. You have to lift weights. You have to do calisthenics.
That means like push-ups,
sit-ups, these things. Exercise. Okay, so how much should you be doing? That would be between 2 to 3 times per week.
All right.
Okay, so that would be every other day.
My tip for you, if you are wanting to bulk up, you know, you go to the same shop that all these fitness people go to, but instead of choosing whey protein, they now have plant-based protein shakes. They contain a lot of protein, like the whey protein, but they're all plant-based. And most of the ingredients for these plant-based proteins are peas, your mongo, right, and soy milk, soy powder. All right, so that's what you can do if you want to bulk up with protein.
Okay. Now let's go to the last thing that you should be taking note of. Okay. So what are the signs of recurrence that you should be mindful about? So number one would be the return of cancer symptoms that you had before. Okay. So for example, you had a lump on your breast and you had surgery. Now that same lump would now recur on the surgical bed or where the surgeon just did the surgery or the incision. So a recurrence of a lump there would mean
it would mean that go call your uncle.
Okay? So that would be an example. Number two is a new or an unusual pain that's unrelated to an injury or the pain doesn't go away. Now this is a sign of metastasis to the bone.
Oh,
okay?
That's dangerous.
Yes, that's dangerous. So that's one. Another one is old age.
Old age.
Okay, arthritis. Well, it happens to everyone.
I think that's a very important one. So if you have like aches and pains all over your body, that don't just ignore that. Like we mentioned at the beginning of the program, it's so convenient now. Do a simple teleconsult. You just need to book a time with a doctor like Dr. Johnson. 5 minutes, just get a peace of mind. Your doctor will probably ask you a few questions just to see if there's other signs and symptoms.
Yes, correct.
And I think after 3 or 4 teleconsults, you'll probably be as good as your doctor as well, as knowing that, hey, just aches and pain is not enough. Do I have any other symptoms? Before you really need to have a scheduled appointment and go all the way down to the clinic to see your oncologist and perhaps get imaging done.
So next would be weight loss without trying. So this is unintentional.
Yeah, that's not a good thing, okay? Everybody's always usually happy about weight loss.
Well, it would be good if you are already overweight. If you're already overweight or obese on the get-go, right? That would be wonderful because you immediately reduce your risk of cancer. Now, if you are already someone on the normal BMI range and you're already someone underweight, then unintentional weight loss would be dangerous.
Yeah, especially if you're having weight loss and you're not doing anything except watching Netflix and eating junk food, and yet you're losing weight. It's not a miracle, okay? It means something is wrong.
Now, don't panic immediately, because there are also other diseases that has a similar effect. So again, this just prompts you to go for a consult. Okay, this is important for you to know so that you just don't just put it on the side. Okay.
Be vigilant. I think
Yes.
that's the key
Okay. Yes,
concept.
correct.
Be vigilant.
Okay. So next one would be easy bleeding or unexplained bruising. So this one is more for patients who have undergone chemotherapy, because we all know chemotherapy side effects is to it destroys the bone marrow and the platelets, grows from the bone marrow. So if your bone marrow is quite destroyed already, then your platelet count can go down. Okay, and a low platelet count can result to easy bleeding or unexplained bruising.
So even
Okay.
though this may not mean that you have cancer, this is something important because you need to address a low platelet count.
Yes.
You need to address a low red blood cell, white blood cell count because that's indicative of your immune system. And as Doc mentioned earlier in the program, you have circulating cancer cells. So you really need your immune system during this time. So if having bruising and bleeding doesn't mean you have cancer, but it means your anti-cancer systems are not working
Not
and you
working.
should take immediate
Okay.
action.
So also for this same sign, for those of you who are leukemic or with leukemia, okay, the moment you see easy bleeding or easy bruisability, then that would be a sign that your leukemia has progressed or it has worsened. Okay, so this should prompt you to go back to your onco immediately.
All right.
Okay. Now, next would be a rash or allergic reaction, such as swelling, severe itching, or wheezing. Okay. Cancer cells sometimes can secrete hormones that mimics this. So it can also be a sign. But of course, an allergic reaction or a rash can mean any other diseases as well. So again, please keep in mind that once you experience these signs, go for a consult, okay? Because this might be more, it's more benign than what you think, okay? Next would be chills and fevers. Now, if you experience chills or fevers, number one, it can mean an infection. More commonly, it can mean an infection. Number two, it can also mean that your cancer has come back. Why? Because cancers have a very high metabolic rate. So if your metabolism is elevated, then you will emit more heat. So that would manifest as a higher body temperature.
Oh, that's
Okay.
an interesting
So
thing to
that
learn.
would also be one of the signs. The next is a frequent headaches. Frequent headaches can mean brain metastasis. Okay.
Okay, another
Yeah,
worrisome
Yes,
thing.
another more worrisome thing. Also, frequent headaches can also mean lack of sleep.
Okay.
It can also mean a very benign thing. So again,
Don't scare yourself.
don't scare yourself. Go for a consult. Okay. Next one will be shortness of breath. This means that your cancer might have metastasized to the lungs, or it can be recurrence of lung cancer. Okay. Bloody stools, blood in your urine would mean colorectal or urinary bladder cancer, or it can also be cervical cancer. Okay.
And do remember, certain
recurrent-
cancers have high recurrence rates, so you
Yes.
should be aware of the average recurrence rate of your cancer. So that will help you adjust how vigilant or how sensitive you are
Yes.
when you see symptoms.
Okay, so next would be another telltale sign would be a cough that doesn't go away. So a cough that doesn't go away is also a sign that the cancer might have might have metastasized to the lungs, or it can, if you have lung cancer, it can be a recurrence as well.
Doc, you keep mentioning metastasize to the lung, to the bone. Is there a reason why you keep mentioning these two organs?
Yes. Because when we talk about recurrence, okay, now keep in mind, if we say that you're on remission, there are already no signs of cancer left in your body. This
Yes.
means that you have undergone surgery as well. Okay, the doctor have already removed the solid tumor. Okay, now if the cancer will come back, a recurrence, usually it's on the surgical site. If it's not on the surgical site, then it's elsewhere.
It has already metastasized.
Yes. If it's elsewhere, that's already metastasis. And more often than not, it's in the brain, it's in the bones, it's in the lungs, or the liver.
Okay, so
those
these four
four.
organs, right? The
Okay.
brain, the bone, the lungs, and the liver.
And the liver. Usually, those are the four very common organs where cancer cells metastasize to. Also, the lymph nodes as well. Okay, but the lymph nodes is more of a regional spread.
Okay.
Okay, so
So now it makes sense why a lot of these symptoms If it's related to the lung, it's related to the lungs. All right.
Right? So by learning all of these, now you will be more equipped to know when you go for a consult. Okay?
And I can see all the questions coming up. Probably more questions on the diet and what other supplementation. So I'm quite sure that some of the viewers will be asking Dr. Jansen, hey, I'm taking this supplement. Is this good? Is this effective?
Yes.
So continue to stay online as people have asked their questions, and I'm sure some of the answers will be of interest to you. So without further ado, let's move on to our Ask Me Anything segment.